is still the conversation here on Lagos Television. Before we took that break, we told you that this morning it will be about us. Because, of course, like I said, it looks like we're going to, again, turn our Friday show into an all-female show. Because 3 women usually are on set on Fridays. And we said that we're special beings, women. We are wonderfully made. And we have our issues, so many of our issues. Sometimes we are misunderstood. Sometimes we ourselves don't even know what is wrong with us. And I was sharing that. I saw a video and a guy said, you know, women, when we ask you what is wrong with you, tell us. And I said, sometimes we also do not know what goes on with us. Because we do have an expert in the studio this morning. She's a women's health expert. And she'll be taking us through as women, what are some of these things that we go through? And again, maybe dispel some myths and set some facts straight so that, you know, we can begin to live better lives as women ourselves. Yewande Banire, thank you for being on the program.
Absolutely. Thanks for having me.
You look absolutely gorgeous.
Thank you. So do you.
Thank you. So when we say women's health, I know it's big and, you know, it can just be something that we must break down and you know, just look at what exactly it is we're talking about. But why is it that sometimes many say, not only men, even women say, we do not understand you as a woman? So is that deliberate? I mean, did God create us like that? Or did we just find ourselves in that space?
You know, you just said it correctly. Women are special. And the reason is because we have so many hormones that kind of dictate how we behave.
Right.
And I always tell my patients, your hormones is you. It's not the other way around.
Right.
So a lot of us, because we have all these hormones that decide what our mood feels like, how we metabolize food, how we think about things, how we react to situations, how we handle stress day to day, it matters.
Right.
And because of that, it reflects on how we respond. So it's really because we have all these hormonal issues. I mean, a lot of women have hormonal imbalances. And it's really because we don't understand what we need to do to help ourselves, especially once we start to reach that age of 35 and older, when we start to experience some of these changes that are natural, but the tips or the tools that we use prior to the age of 35 no longer works from then on. So it's really just us understanding these changes so that way we can start to work with our body instead of against. So you're right. Sometimes someone would ask, what do you guys want? Sometimes we don't know because it depends on where we are. Are we on our cycle?
At that moment,
Are we expecting our period? Are we ovulating? So it really just depends on what we're going through.
I mean, fantastic, because I was going to ask you that also, do we need to start looking out for these things at a particular age? And you've just answered that by saying at least from 35. But there's also that possibility that you could start reaching these milestones before 35.
Absolutely. Absolutely. And I actually want people to start to learn about this before the age of 35. Because what happens is that when you're in the nick of things, then you throw everything at it because you don't understand what's going on. But if we start to teach our teenagers or our young adults about these processes that would happen, then we can prepare them better. Just like we prepare people for pregnancy. People know once you get pregnant, you have to see a doctor, you have to go for antenatal visits, there are things that you have to follow because we have these open conversations. Our culture is big on fertility, right? So we need to have conversations about these changes that would naturally occur. As long as you're a woman, you will experience these changes. So it's really about learning about them when you're younger so that you know what to look out for. So that when you see it, you can identify it and then you can seek the proper help.
Right. We'll come to seeking proper help. I know Adebimpe is itching to ask a question. Are we ready for your question?
Yes, my question is leaned towards, you know, seeking proper health, because I want you to tell us, you know, the proper checks a woman should take at every stage of her life.
So the first thing first is we need to normalize going for a physical checkup without being sick. A lot of us don't do that. That's not a concept that we've used to in Nigeria. So if you tell a 10-year-old right now that was just sitting and watching TV that I'm taking to the doctor tomorrow, she'll be like, but I'm not sick.
I'm not sick.
Because she's not used to that. So we need to change that narrative of only going to the doctor when we're sick. So that way we understand our baseline, right? So you go in when you're not sick. Your numbers will look different if you see a doctor when you're not sick versus if you go to a doctor when you're sick. But if you have a baseline, then your doctor will say, okay, well, maybe this is because you're sick. So we don't begin treatments that you don't necessarily need.
Okay.
And one example is this. If you get your labs done when you have a cold or when you have a cough, some of those markers will be elevated. But it's your body's response of trying to protect you because it wants to heal. However, if you go to the doctor on that day and you've never gone to a doctor before, you don't have any baseline, they can start to treat you because they think there's something wrong. So those are the things that we need to change. But if you have a baseline, then your doctor will say, you know what, maybe because you're not feeling good, maybe that's why these numbers look this way. Let's do a retest in about maybe 2 months or 8 weeks when you're feeling better. So we need to normalize, first of all, going to the doctor. We need to emphasize the importance of sleep because our body resets during sleep. And a lot of us take it for granted because a lot of us can function, a lot of women can function without proper sleep. Even if you get 3 hours of sleep, we still have the ability to push through. And because of that, we think, oh, we can just do it. We need to prioritize sleep. We need to manage our stress better. A lot of us accumulate so much stress from work, from family members, from our own immediate family, and this causes chronic conditions. So, first thing first is we need to normalize going for checkups at a young age so that way we understand our body. We need to speak up as well. I know there's a stigma of shame. A lot of people are judged when you talk about whatever's going on with you. So because of that, people don't want to share. And that leads to more complications because then they sit on it, they wait it out. And by the time we start to treat it, then we're chasing it. So these are the little things that we can do. Once you notice there's a change, speak up. Find someone that will listen to you, because I know women are oftentimes dismissed because sometimes they think we're exaggerating. But speak up and continue to advocate until you find someone that would help you.
Okay, I want us to look at our cultural expectations, especially here for us here in Africa, that sees that a woman must prioritize her family even over her welfare. I want you to look at how this is also affecting the health of women.
Absolutely, and it's mentally overwhelming for you to be in this position to always prioritize your family instead of yourself, because you can only give the best of yourself if you feel good yourself. And that's why you find sometimes some kids have the memory of their mom just nagging all day, just nagging all the time. They think about it, it's a toxic environment for them. It's not intentional. It's just because she's just so overwhelmed with all of these responsibilities that we've imposed on her that she hasn't had time to really hold on to her own identity or find herself. So it affects the family, it affects the community, it affects our work because she's not happy. And then it can lead to mood swings. And then sometimes you're sad, sometimes you're happy, and you can't find a good balance. And this affects your hormones because it throws it off. Because that means you're carrying this chronic stress that puts your body in a state of inflammation. So you feel it physically too. Your body hurts, you're not sleeping well. So overall, that woman will not be able to thrive in that situation.
Right. So I'm sure that you've dealt with a lot of women in your line of work, and you've heard so many things. Tell us, peradventure there's any or there are myths that you've heard and you want to dispel this morning, because sometimes when we grow with certain things, we think they're the norm. And when things go the other way, go south, you think, oh, am I an alien? Why is this happening to me? So share with us, what are some of the most heard myths, especially here in Nigeria, that you'd like to dispel or correct this morning?
The first thing is that it's a normal transition. So because of that, you should endure. And that's a myth that we need to correct. Because it's a normal transition that women experience, does not mean we need to suffer through it.
Right.
Because we have resources that can help. And this hormone imbalances, this changes actually affect us long term. It puts us at a risk for cardiovascular disease. It puts us at a risk for diabetes. It puts us at a risk for elevated blood pressure. So it's not just something you just want to do just because. So that's a huge myth to say, oh, well, it's a natural part of transition, so why should we do anything about it?
Okay.
What we're trying to do is age gracefully. Because if your vision is going out, you would need glasses.
Sure.
If you need hearing aids, you will get it. You can get surgery for your knees. So we need to be comfortable replacing these hormones when we get to that stage. The other thing is just, oh, you're too young to experience it. There's nothing like that. Because everybody goes through different life situations that change how our body responds to stress. Like someone who sells or who works all day, she's probably in chronic stress all day. So because of that, our hormones are very imbalanced, right? So that kind of person can actually start to experience symptoms at the age of 30 or even younger. And then we have other symptoms like the thyroid. So I don't want, oh, you're too young, so you shouldn't be there. And the other myth is that when you're seeing your period, you shouldn't experience symptoms of perimenopause, symptoms of menopause, but that's false. Because perimenopause means transition to menopause. It means you should still be seeing your period. And actually, that is a zone of chaos. That's when a lot of women really feel it, because there's that imbalance between estrogen and progesterone. So you have the hot flashes, the mood swings, the irritability, you're not sleeping well. So because of that, you can still be seeing your period and still be experiencing hormonal imbalances.
All right, so how do you know? Because again, sometimes because we do not talk about those things enough, and then you think, oh, who do I approach to speak to? Who is the best person to give me help, especially during this period? So for a woman, who is the best person to speak with?
So what I tell women is that I want you to see a doctor who's familiar with hormones. I know that some women would say, oh, maybe I should go see a gynecologist or an endocrinologist. A lot of us that do hormonal health have taken extra certifications and extra trainings to make us comfortable in prescribing hormone therapy. So I needed to find a doctor and ask them, first of all, check the credentials, because we know a lot of people share all this information on WhatsApp. And it's very hard to find out what's true. And it's so unfortunate. And that's why a lot of us started showing up on social media, because that's the only way we can debunk some of this. We need to meet the patients where they are. A lot of them are on social media. So we need to understand what's going on, be able to speak about it, because conversations like this will normalize people sharing it.
Sure.
We need to learn to not judge people. Because you haven't experienced perimenopause doesn't mean my symptoms are not severe.
Right.
And it also doesn't have to be life-threatening. You don't have to be suffering so much before you ask for help, okay? So ask for a doctor who's comfortable with hormones, and that is the person you should see. It's not their title, their credentials matter, but you need to make sure someone who's comfortable with hormone therapy.
Okay. Ladies?
Yes. I want to talk about menstruation with young girls. You said something earlier about when you said, oh, she's too young to be experiencing this. So I want to ask you now, is it normal for an 8 to 9-year-old girl to get her periods? Is it normal for her?
Well, things have changed. So now that's a very nuanced question. We used to say we expect their menstruation about the age of 12 or 13. But
or
kids,
even 15.
Or 15. But now our food, a lot of this food are grown with all these steroids. And because of that, it matures those kids a little earlier.
But does it affect them negatively in any way?
Well, not that it affects them negatively, it's just that it exposes them to the hormonal imbalances at a younger age. So they start to experience those symptoms that they may not be able to articulate. For instance, teenagers can go through what we call PMDD, which is where they have this severe depression a few days before their period. They might be old enough to articulate, or you might be able to see that they're just so sad a few days before their period, or they are experiencing migraine. So they might be able to articulate it. A 8 or 9-year-old might not be able to explain that. So that's a disadvantage. So if you have an 8 or 9-year-old that's starting a period earlier, that means we need to pay extra attention and monitor, so that way we can catch those hormonal symptoms that usually will present in our age.
Follow up, sorry Joy, just to follow up on Adebimbe's question will be, at what age then should you be worried that your young girl hasn't started her period?
Probably about 16. Yeah, so by the age of 15, 16, once they start to develop, breasts and things like that, and they haven't seen their period, then it's time to probably look into it a little bit.
Okay.
Yeah.
Joy?
Okay, away from menstruation now, I'm still going back to African culture and motherhood, because African culture sees motherhood as the validation of womanhood.
Yeah.
And so I also want us to look at how it affects the mental wellness of a woman who has not been able to conceive.
It pushes them into depression, and we know depression kills. It's a very unfortunate situation because there's so much pressure put on the woman, as if she's the only one who's responsible for conceiving. It's not the only woman who's responsible. It's a man and a woman. And sometimes it just doesn't happen. It doesn't mean there's something wrong. Sometimes we don't find a cause. We run all the tests, we check everything, and we can't find a cause. And then we put this much pressure, and not only even with conceiving, also with the mode of delivery. C-section versus vaginal delivery. Like, we just have so many misconceptions about this thing. Like, do you want a healthy baby? Do we want the mother to survive? Do we want the baby to survive? We already have an alarming maternal death in Nigeria. And some of the reasons is because there's this stigma about the mode of delivery. So when they're even in distress, they don't want to go through a C-section because they feel like that's not natural. It doesn't make them whole enough. So we have so much work to do when it comes to women. And it pushes a lot of people to anxiety. They're very anxious. They're very depressed because they feel like it's their fault. And oftentimes, it's not.
Right.
So we need to start changing some of these narratives.
So when you say we have a lot, we still have a lot to do. What are you trying to say? Is it that we don't have enough qualified health practitioners to handle women issues?
Or is the society?
Or is it the societal
It's
thing?
a society. We don't have these conversations enough.
Okay.
We don't. So because we don't have these conversations enough, they're very hush-hush. So because of that, there's no awareness. So nobody wants to really share it because you come out, you say, oh, you know, let's say for instance you have PCOS. PCOS can affect your fertility because it can affect your ovulation, but it doesn't mean you cannot conceive.
Right.
But when you voice out and say you have PCOS, you know, people are already judging that, oh, she's not going to be able to have kids. So we don't have these conversations enough. That is the problem. We need to equip our community workers with all this information because they get in touch with all those people, especially in the rural areas. Not everybody's on social media. A lot of us are getting on social media now talking. Now imagine people don't go to the doctor until they're sick. And when they go to the doctor, you think they're worried about something else? No, at that point, they're just worried about what's going on right then. So we don't have these conversations enough, and that's what's putting us in this situation.
So going back to issues around menopause, which I mentioned earlier, there are also things, you know, within that age bracket or that time that, you know, there's so many myths also associated with that. So menopause, your well-being as a woman, and also your vitality as a woman. What's there to clear?
So the problem that we have in our society is that when people see menopausal women, they think it's over. They
We
think,
feel
oh,
it's over.
that's what they think. That's what they think. They think, oh, well, what does she need anymore? She's done. And that's not fair. That's not right. A lot of us are living to about 70s, 80s now. Imagine if you go into menopause at 50, you have 30 years of suffering. That's not fair.
Wow.
That's the problem. People just think, oh, she's done. Oh, she's old. She can. No. No, a woman deserves to continue to thrive at any age.
Right.
At any age, because it affects your memory. You keep forgetting things. Now it can affect your mood. So you don't have any motivations to do the things that usually will bring you joy. You know, your body starts to hurt. It can lead to women, especially slim women, have a risk of osteoporosis, which means that you're prone to fracture. So that means you're trying to reach for a cup and then your ribs crack. And then what? And then it leads to incontinence, urinary frequency. It goes on and on and on. And people just they see the age and they're like, oh, she doesn't need anything else. No, she deserves to continue to live a healthy life until she passes on. And we have resources that can help. That's the most challenging part of it. It's not like we need to reinvent anything. Like people deal with women like we're a new species. We're not a new species. We've been existing.
We've been there.
We've been just like everybody else.
I hope the men are listening.
I hope they are.
Husbands.
Most definitely.
I hope you are. This is not the time to abandon your wife.
It's not.
Because
It's not.
sometimes this is an avenue, or this is a time for men to say, okay, I think I need a younger woman.
Exactly, exactly. And imagine you come in here and you say, oh, well, every time I ask her to come, she doesn't feel like it. Because she doesn't feel good.
That's not her fault.
Because she's not sleeping well. Because she's dry down there, so it hurts.
Yeah.
You know, because she's not joyful. She has all these mood swings. 1 minute she's happy, 1 minute she's highly irritable. Now you're asking her to come. That's the last thing on her mind. She doesn't feel good. So we need men to understand that this is natural. And women, these are real symptoms. You know, people just think about malaria, typhoid, cancer, and then if you're breastfeeding, that's it.
Yeah.
Like women are just here to just deliver babies. And no, we're here to live our own lives. We deserve to be healthy. And if we say we don't feel good, maybe be concerned a little bit and try to encourage her and help her a little bit too.
Yeah.
Because a lot of women carry all this, you know, all this domestic
So
role.
I mean, from what Adebimpe said, that, you know, it's a challenge that men must also begin to make themselves available and also a support system. is it okay that we also begin to normalize talking about these things before menopause sets in, so you both are in a good place to approach that time together? Because sometimes, again, you feel they know. They also do not know.
No, they don't.
They also do not know. So how best is it to approach and get prepared for that time of your life?
I think as soon as you get married,
okay.
as soon as you're in a relationship, these are conversations we need to be open having, because open conversations will set the right expectations. Because we go on assuming that you should know that I'm not feeling good. No, it doesn't. You need to be able to say, I don't feel good, I don't feel well. And that man needs to be able to make you feel like you can talk to him like that.
Right.
Because a lot of women want to be vulnerable, but then their husbands don't want to listen.
The shoulders aren't there.
They're not, you know, they're dismissed. So you need to start having those conversations as soon as you guys are looking to create a family, because it will affect the family, right? Because if you get to that point where you just don't understand what's going on with you, inside of you, you're bothered, you're terrified because you think it's something else.
Right.
But you have no idea. But once you know what it is, and you guys have the conversations, even if it's jokingly, because men experience, you know, andropause too.
Andropause too, yeah.
So sometimes a woman's symptoms is actually triggered by her husband because he's moody, he's irritable, you know, now she thinks she's doing something else, but it's not. It's just, his hormones are shifting. So because of that worry, then she puts herself in this heightened sense of stress, and then triggers her own hormonal imbalance, and then the kids feel it.
Wow. It's a cycle.
It's a ripple effect.
Right.
But if we have this conversation and we're familiar with it, then it helps us. Like my 16-year-old, he listens to my social media all the time. And sometimes he would tease me when I say something like, Mom, is it your hormones? I'm like, really? Really?
Like, are you sure that's not you?
Exactly. It's like, Mom, is it your hormones? I'm like, how about, is it you? So because they listen to it all the time, so whether they like it or not, they're becoming familiar with that concept.
Right.
Because I have all boys, so I need them to be able to help their wives.
Mom of boys. I mean, fantastic.
Mommy
They should
boys.
be able, yeah,
Both
to
mommy
help,
boys.
to help their
Okay,
okay, Joy?
Yeah, I'd like us to also look at some silent health issues that women often ignore and that can become life-threatening later, because you also raised the point that we have the habit of not visiting the hospitals for regular checkups. We only go when we are sick. So I'd like you to, you know, touch on that.
Yes. So one of the symptoms is if you're tired all the time, you know, this extreme fatigue, and even after you get some sleep, you still wake up tired. That's a sign, because it can be your iron, it can be your hormones, it can be your thyroid. And these are things that, like I said, causes a ripple effect. If you find yourself just urinating too frequently, you're peeing all the time, you need to look into that, because it could be a UTI. And people always think, oh, if I have a UTI, I have to have some symptoms, it has to burn, it has to, not necessarily. Some people, it's just that frequency. You're waking up numerous times during the night, you're waking up, you're having pelvic pain. Those are things we need to talk about. If your period is heavy and you're having like clots, it's not normal. If your period is more than 5 days, it's not normal. Those are the things we need to look out for. And we just brush them off. Sometimes some people start to have like heart palpitations, their heart rate starts to, and they think, oh, it's because I worked too hard at the market yesterday. No, these are things, this is your body's way of giving you signals to say there's something changing. It might not be wrong yet, but it's saying there's something changing, and I'm giving you the alarm, and oftentimes we don't listen. If you're waking up all the time with a headache, you shouldn't be having a headache. It's not normal for women or men to be having a headache. True. So if you're having a headache all the time, we need to look into that. We need to make sure your blood pressure is not too elevated. So those are the things that we need to monitor that are very subtle. They creep in slowly. If you're not sleeping well, because sometimes sleep is so important, like I said, because you might not be sleeping well because your blood sugar drops too low at night. So your body wakes you up because it's not trying to die. You might not be sleeping well because you have sleep apnea. So you're not breathing at a certain time, so your body wakes you up. So we need to look into why you're not sleeping so that we can manage these conditions better.
Does nutrition, exercise, dieting, do they play any roles in these situations?
Oh, absolutely, especially nutrition. We need, especially for women, we need about 100 to 120 grams of protein, and a lot of us don't get half of that. And what I always tell my patients is that for every meal, make sure you have protein and fiber. And the protein should be about the palm of your hand with every meal. So that will get you close to that number. So if you do that 3 times a day, you're getting closer. Movement is very important. When you move, your detox pathways gets rid of toxins. So movement in any form, dancing, walking, whatever. We need to minimize our exposure to toxins. Makeup, they disrupt our hormone. The cleaning.
You say makeup.
I know makeup too much. we're all on that table. Okay?
So you actually came back whether you heard that right or not.
We're all on that table. It does, because it contains a lot of chemicals. They contain a lot of additives, and they get in our bloodstream because our high shadow, they're so close to our pores, they get into our stream, and they affect our hormones. A lot of the cleaning supplies we use at home, a lot of us use plastics. They affect our hormones. So those are the things that we can minimize that can help balance them a little bit. Eat healthy, move around, drink water, sleep, and you should be able to be fine to your best ability.
So career progression, what you do, also do they play a role here? If you're stressed at work or stressed, in life generally, how does this also affect your well-being?
Oh, stress is a big one, because what happens is that if you're stressed at work, when you hurt yourself, for instance, your body will send like white blood cells to heal it. That's a good type of inflammation. That's acute inflammation. When it heals it, it goes away. When you're stressed, you stay in this chronic heightened state of inflammation, because when you're stressed, cortisol goes up. Cortisol is a stress hormone. It's a good thing if it stays up for a short while, but when you're constantly stressed, it stays up all the time. Yeah. And what happens is when it stays up, it pulls insulin with it, so your sugar starts to go up. It pulls fat. You start to gain weight because of stress. Sometimes weight gain is not as a result of diet. You find some people tell you, oh, I only eat once a day, but it's because they're stressed. So their body starts to hold on to fat because of that cortisol.
Okay. Again, let's look at, because we know that women thrive in stages of life. So take us through the stages. Again, I know you've talked about, as a young girl, menstruation, and then again you touched on menopause and all of that. But again, looking at how women progress as we age, what are some of those things that, again, as a matter of not urgency, but as a matter of as a routine, we must look out for as we age? And it is what you know that you can pass on. As a mother, if you're not aware, what then are you teaching your children? So how important it is that as women, we also know some of these things, because we're also raising generations.
Oh, it's very important, because let's start from menstruation. You have a puberty a daughter who's going through menstruation. And then you see that before a period starts, she has this mood swings, she's crying all the time. Pay attention to that. It's not normal. Okay. She could be experiencing this huge hormonal shift before a period, and we have ways to help her with it. If you notice, and then the menstruation, if she notices that her period is like 5 to 7 days, she's cramping a lot, she has heavy blood clots, pay attention to that. Period pain is not normal. I know that it's so common that we all think, oh, that's normal. It's not. Right. So if she's cramping a lot, look at that. And then we move into the reproductive years, which is the pre-menopause. And this is young women in their 20s, early 30s, that are looking to conceive. If you find yourself having difficulty conceiving when you're actively trying, look into it. We wait too long sometimes. Sometimes it might be something minor. So that's one thing you want to pay attention to. If you're always tired all the time at that age too, because a lot of us as Black women, we have a tendency to have a higher, heavier menstrual period. Most people are low in iron, and they don't know that. And ferritin is very important because it helps your red blood cells. It helps you circulate. So you find someone who's always tired because they don't have enough red blood cells. They don't have enough iron. So pay attention to that. That's a pre. And then we move into perimenopause. If you're forgetting things, you walk into a room, you can't remember what you walked in for. You're losing your car keys all the time. Speak up. It's not normal. Okay. Your husband is chewing and you feel like he's chewing too loud. You're so irritated. It's not normal. That's the peri. But you can still be seeing your period, right? And your period might actually get lighter or heavier at that phase. And then we move into the menopause, where you're no longer seeing your period, because menopause is defined as 12 months of not seeing your period at all. Okay. So then some of these physical symptoms that some people did not experience in perimenopause because they were lucky may start appearing in menopause. Okay. And if they don't even experience the physical symptoms, it starts to show in their blood markers. Their cholesterol starts to go up. And when you have elevated cholesterol, what does that put you at risk for? A heart attack. Right. So those are the things we need to pay attention to help ourselves overall throughout this cycle.
So as women, you've taken us through what we should be looking out for in terms of age range and all of that. What does networking do for women, especially with issues like this? Sometimes it might just be for someone else to lend, you know, a ear to you, just to listen to you without necessarily using the doctor or, so what does networking, meeting other women of like minds, what does it do to women, especially who are experiencing such issues?
Oh, healthy networking allows women to thrive because it gives them a room to be vulnerable, to actually talk about what they're going through.
Okay.
So it's very important because once you share, then you have someone else who has a suggestion or someone who has a hormonal doctor or can share some of the resources that they use that works for them. It also opens your mind because you know you're not alone. So that alone takes the weight off of you because you're worried something wrong with me. So it validates that, okay, this is something a lot of these women are going through if it's healthy, right? So those are the ways that we can continue to, and it also helps to spread awareness.
Right.
So that way, if you're not familiar with these terms, then you start to pick it up from your friends because sometimes they're trusted people, right? Sometimes when a doctor tells you, you're almost like, oh, yeah, right. But when someone you trust, a family member or someone you respect tells you in a different form, you're more receptive to actually adhering to that advice.
You mentioned PCOS earlier, and I know that that's one of the most common issues that women face. We also have issues with fibroid. We also have issues sometimes with, you know, some cancers, you know, with women. But what exactly, how do you advise women to navigate some of these health issues, or what are some of the most recommended tests that women should carry out? Although you did say that we must normalize, you know, regular checks, even when you're not feeling unwell. But from a certain age, usually I think it's from 35, like you said, 35, 40, then you must begin to be intentional about your health. So what are some, even if you do not have anything known to you, what are some of the tests that you must begin to submit yourselves to?
So usually it starts with the general health markers that we do, like this comprehensive blood panel. That's when we check your hemoglobin, we check your hematocrit, make sure that your blood level is good. We do what we call the CMP, which is a comprehensive panel. That's when we check your liver function, your protein. We look at your electrolyte, your sodium, your potassium, because all of those are important for your heart. And then we move into the hormones, your progesterone, your estrogen, your testosterone. And we know that the hormones fluctuate, but they're important. So we check them just to have a baseline. Then we look at your thyroid. Thyroid is very important too, because it just, most of these symptoms mimic each other. So it might be one area. So if you're not looking at, if you're just focusing on one area, you might miss it. We need to check iron. Like I said, a lot of black women,
deficiency.
it's exactly iron deficiency, and which includes your ferritin. We need to be proactive about checking our vitamin D.
Okay.
A lot of black women, black people generally, we don't have enough vitamin D because the melanin in our skin
Is already
prevents how we convert. So vitamin D is a big one. Vitamin B12. We all need magnesium. So those are the things that we need to check, at least as baseline. We have some inflammatory markers too that we check as baseline, just so that we can see when things start to progress, including your A1C for your sugar or your insulin. So those are the markers that we need to kind of check over time so that we can track it when things start to shift.
Sorry, Adebimpe, I know you're itching to ask a question, but then because she's mentioned these issues, so some women also sometimes at 40 begins to stay on, what do you call those things now? Vitamins, and then you prescribe these things for yourself. You know, there are things that you see for women over 40. Is it good to prescribe those things yourself, or you must get checked before you start buying OTCs?
You should be checked before you get OTCs. A lot of people think because they're OTCs, they're healthy, they're natural. There's nothing like that. Because your liver still has to metabolize this medication, and not everybody needs it. So we need to speak to a medical provider and make sure we're only taking what we need. Because even though they are vitamins, you can overdose on vitamins. It can be too much for your body. And they put your liver in this stress. So if you're taking all these supplements, nobody's checking you, you're not talking to a doctor, you can actually cause a lot of damage.
Okay, all right. Adebimpe, was it Joy?
Joy, yes. It's a concern for me, since we're talking about, for us, since we're talking about wellness in women. Now, this is for young girls. I want us to talk about body odor. I just saw something now that, aside personal hygiene, it can also be hormonal.
Yes.
So I'd like you to shed light on this.
Yes. So, you know, body odor is very, and unfortunately for the young girls, it's a very challenging situation to have. And sometimes, like, it could be their hormones. Sometimes, because some of them could have PCOS. PCOS makes your skin more oily. Because your skin is more oily, you're more prone to sweating a lot. So because of that, you start to have body odor. So it's hormonal. Sometimes one of the symptoms of perimenopause actually is body odor in some people, because once you start to have those changes, it affects your sweat glands as well. So body odor is one thing that if you have a daughter or a son who is experiencing body odor, you need to take them to the doctor, because it can be even their sugar. They might just have high insulin. It might be their hormones that is imbalanced. And if we correct all of those things, we might be able to help them. So I always say, if your child, apart from hygiene, if it's a child that takes a shower every day, and of course if you go out and you sweat a lot, you could have it. But once you take a shower, you shouldn't have this lingering odor. We know what body odor means, right? You shouldn't have this lingering odor. It's time to check with a doctor.
Is it the same as mouth odor?
It is.
Okay.
It is. Halitosis. It is. Sometimes it's not just about the hygiene.
Okay.
It's a lot. Sometimes some people have infection in their tonsils and all of that, and it's chronic. It keeps happening. So we need to have them checked.
All right. Before we allow you go, I'd also like for you to speak to the facts that, you know, as women, we also love to copy ourselves a lot. So that I'm using a particular supplement, my friend could also say, oh, fantastic, can I buy same? So talk to us how good or bad it is to follow the trend.
That's a terrible
and do things
habit.
because people are doing it.
That's a terrible habit, and that's what puts us in all of this. A lot of us just want to do what other person is doing. Oh, because she said this works for her, it must work for me too.
Okay.
But we are so different, and we have different health challenges. And unfortunately for us, we don't even know some of the issues that we have.
Sure.
We're just walking around with all of this. And some people have issues with their blood thinning. Some people have issues with blood. They don't even know that. And then your friend is taking these vitamin supplements, and then you take it, and then it has something that would trigger what's going on.
Yeah.
And unfortunately, you start to notice that there's something going on. But because it's a vitamin, you think, oh, it can't be this now.
Yeah.
This is natural. No, it doesn't mean it won't have any side effect. So we need to stop that trend. Before you get on anything, make sure you see a licensed provider.
Right.
Make sure you're only taking what you need. Because sometimes not everybody needs all the supplement.
True.
If you're eating a whole diet in protein, you might not need some of these supplements.
Does this also include body cream, perfumes, and things that we wear?
All of it.
Skincare.
All of it. All of it.
Skincare.
All of it. And that's why some people will recommend a skincare to you, and then you're breaking out.
Down.
And they can swear that it works for
Glowing.
them. And then sometimes, you know, we don't exactly tell each other the truth 100%. You know, sometimes we say it's water and skincare, but it's something else. And then you were using this thinking, well, it worked for her,
not
but she didn't
working.
tell you exactly what so sometimes you gotta take what people tell you with a grain of salt, okay? So that's why don't follow the trend.
Just do you.
Look for what works
for
specifically
you.
for you, because it differs per person.
All right, Yewande, before we allow you go finally, any other thing you'd like to share with our viewers before you take your leave today?
So I would say it's not normal to suffer. We don't need to suffer. We have so many resources. We have so many tools. What we're trying to do, we're not trying to stop aging. We're trying to help you age gracefully.
All right. Thank you so much, Yewande Banire, for finding time to be with us on the program today. We appreciate your thoughts.
Absolutely. Thank you for having me.
Right, of course, we've been speaking with our guest this morning, and I'm sure she's taking us through so many areas this morning. And like she said, do what works for you. Do not follow the trend, because honestly, following that trend thing has gotten a lot of people into trouble. So, and of course, you can seek help. Of course, she's on socials. You can find her if you need more help, or you'd like for her to clarify some issues for you. We'll take a quick break. When we return, Joy and Adebimpe will continue this conversation, hopefully.